And what I want to do is to show particularly the connection between the two key determinants, I would say, of our age, and that is the commercial determinants of health. And I, together with others, about 10 years ago, launched the work on the commercial determinants. And some of you will know that some important articles, particularly a Lancet series and WHO work, has taken this forward. And now in the group, the lab that I lead, we work on what we have called the digital determinants of health. The DTH lab, if you want some more background, and you see there's a code here, grew out of a Lancet Commission on Governing Health Futures, growing up in a digital world. And we have focused particularly on the health of children and young people, the public health consequences of that, and I'll say more about that later. And we have, and this is absolutely critical, we have done all our work together with young people. So the goal is to drive inclusive and equitable digital transformations for health, obviously through research, through policy, through partnerships, and as I've said, working with young people. Now, our work is built, and that's related to many of the organizations that have spoken right now, on the Ottawa Charter for Health Promotion. And if you look at the next slide, some of you might be familiar with the Ottawa Charter. And that charter speaks about health being created in everyday life. And initially, the charter said where people live, love, work, and play. And that, of course, refers to many of the determinants I'll come back to in a minute. But what we have said since then is that, of course, something we didn't know in the 80s and 90s is that this health is also created where people Google, where they shop, and where they interact on social media, where they travel. And the thing that we are confronted with all around the world is an increasing commercialization and a digitalization of everyday life. Everything seems to have a price. And we are in a situation, and one of the speakers alluded to it a little bit earlier, that we are losing sight of the public good, both at the national level, the local level, and of course at the global level. If we go to the next slide, you will see one of the most important pictures that has come out of health promotion, and that is this famous rainbow on the determinants of health. And that rainbow has changed significantly, first of all, because of the colors, but also, if anybody remembers, the initial rainbow in the center had a much smaller group of people, actually at one stage a rather traditional family picture. And you can see that now already our understanding of inclusiveness, of community, etc., has also entered this picture. But if we look at the various factors that determine health, the individual, the social, the living and working conditions, and of course, the larger environment you can see on the rainbow. And here again, we have learned since the 80s and 90s how important our ecological context is, the impact of the environment, and many of the planetary factors. And it's very interesting to see, and again, the organizations that have spoken earlier are leading this discussion as well, to see the elements that are critical in terms of planetary health and the interface between the health of humans and the planet. So in German, we have this wonderful word Zwischenzeit, that is the time between times. That is expressing that we are in a situation of very big change, and that also means we feel threatened, but it's also an opportunity to address the factors, how we want to see our future. So the next slide basically gives an indication of what we want to express and what we haven't quite grappled with yet in this time between times. And that is that in many of the discussions, we see the internet or the digital or AI as a technology, as a factor, a single factor that influences our health or other parts of our lives. But increasingly in the discussion we're having also in our lab, we are starting to see the digital as an environment. It's we have, sort of the real world environment, the analog environment, and we have a virtual environment, and we move between these two worlds. And a number of thinkers are actually speaking about the fact that we are in a period of world building, and that particularly young people move between these two worlds without much differentiation. And it's an environment, a medium in which we move, and in turn, which reacts to our moves. And this is the really important thing, particularly now with AI, that all our moves in this environment actually are reflected back on us and to some extent are extracted with data. And I'll come back to that. So if we are looking at this world building, we've seen that some people in the literature that is growing also on the digital determinants of health have tried to take the original rainbow, and there's an example on the next slide, have tried to take the original rainbow and shown, you can see that here in the various areas, how the digital is influencing the various elements of the rainbow, and they call that the digital rainbow. But that, of course, doesn't totally reflect this world-building dimension, and that is one of the intellectual and analytical challenges also for us in public health. Basically shows all the dimensions that we need to look at, and the time doesn't allow to go through all of them, but you're going to get these slides, and you can work your way through them in more detail if you so wish. Now, of course, one of the key factors around the digital determinants and the rainbow is that the social determinants, and particularly the inequalities that we face in health promotion and public health, both at the local, the national, and the global level, are also influenced by a digital divide. And so we are seeing, and the next slide refers to that, is that increasingly many of the social determinants and inequalities are either mirrored in terms of the digital divide and are often reinforced through the digital divide. And that, of course, starts from whether one has access to infrastructure, whether one has access to electricity. We've done surveys with young people all around the world, and it's also a question of access, where one young man said to us, I decide in the morning whether I eat or whether I go into the digital world. So these are really critical and important things that we have to work on in more detail. So since you will be focusing on the commercial determinants, we have to see that, of course, the commercial determinants that we started working on 10 years ago, without that view on the digital determinants, it's now so much clearer to us that they thrive in the digital transformation. So in many ways, the digital world, as it says on the next slide, the digital world reinforces many of the commercial determinants, and gives new ability to many of the commercial actors to actually reach out to people. And I've just summarized here some of the one of the definitions of commercial determinants, private sector of activities that affect people's health. And of course, here we need to see that the digital platforms are not just platforms for the other commercial actors. They themselves are commercial actors. And this is something we often do not see. We see the digital as a technology. We don't see the digital realm as a structural actor, just as the companies in the commercial sector. These platforms are companies, and they are more powerful than many of the sectors we have worked with before. And a critical point is that, and this is the fourth point here on this slide, that they are able to use data as a business model and as a source for profit. And that is what I try to express in the next slide. I was at a meeting recently where a young person stood up and said how important it was in the poor country that he was living in, that they had access to the internet for free. And that, of course, is not the case. The internet is not for free. You don't pay a sum, even though increasingly you have to pay for services. If we could have the next slide, please. But basically, you are paying with your information, you are paying with your data, you are paying with your digital life. And increasingly, everything that you do, if you're online all the time, if you have an Apple Watch, if you're doing all kinds of things, is actually used and is mirrored back to you, particularly now through artificial intelligence as well. And therefore, as it says on the next slide, the data extraction is actually one of the most important things that is happening in relation to this combination of the digital and the commercial determinants of health. And this business model around data relies on the extraction, commodification, and monetization of personal data on an unprecedented scale, and very often without the explicit consent or full understanding even of the individual. Some colleagues in the academic field have called this surveillance capitalism, and I suggest as part of your work on the commercial determinants, you also look at that. So I'll rush a bit through the next couple of slides. We are therefore faced with a big challenge of how we can use the obvious, positive elements of this digital transformation to an increasing extent to generate more public value rather than private profit. And many of the international organizations, including UNESCO, UNICEF, WHO, etc., are trying to work on this and are particularly trying to see what the impact is on the health of young people. And of course, coming as many of you do from the education realm, what the potential but also the dangers are in relation to education. And so one of the speakers earlier also said, we have to work intersectorally in this field. And one of the cross-cutting principles for all of these recommended actions that come from many of these organizations is that the next generation needs to be part, if we could have the next slide, needs to be part of defining the future of how we attract the digital determinants of health. So Very quickly, if we go to the next couple of slides, I hope you'll be able to study them. On this slide, you can see how we in the Digital Health Lab are trying to define the digital determinants of health in terms of digital ecosystems, platforms, and data systems that inform different parts of the health sector. And if you go to the next slide, we try to show how that intersection works, how the business model works, which takes us to the commercial determinant, how marketing and data-driven advertising takes place on the platforms, how they are channels for harmful products and are actually trying to avoid legal restrictions that they face in the real world by using new strategies in the digital world, for example, influencers. And of course, we're confronted with the big issue of health misinformation, and that is becoming an increasing challenge in the public health arena. A key new dimension of the commercial determinants is the social commerce, and that is the marketing and selling of products through social media platforms. And that is done in so many different ways and has very, very little restriction. And there are new strategies now to use AI to even reinforce that, so that, you know, whatever you see, a little video, a little chat or something, you can click to buy a product straight away. And of course, that is organized in a way that it entices you to click very quickly. So if you look at commercial determinants, please do also look at the social commerce. A key factor in this context are the social influences. And you can see, and many of you, I'm sure, have been watching suggestions by the social influencers. And for public health, this is really, really critical because there is practically no regulation. There is a lack of norms. You know, how can you reach out? Because this is global. You know, you sit in Germany and you get a wrong information from somebody who happens to be in Canada or the United States. There are no global regulations that allow you to address these new forms of marketing and social commerce. So to come towards the end, what we are working on is, on the one hand, to work with public health actors, particularly the WHO, etc., to restrict digital marketing, a really, really big challenge. And WHO has entered this field, and I encourage you to look at their materials. We have worked with the European presidency, the presidency of the European Union, the Polish presidency recently, for a set of recommendations for ministries of health and public health officials. And we also hope that the public health associations will take up these recommendations. You can see some of these recommendations on the next slide. There is a publication that you can access with an annex of all the policies that are already in place, not enough of them, I might add, but you can see particularly hold industry and commercial interests to account, support and initiate future laws and regulation to make digital environments healthy places for young people. And this is one of the challenges in the interface of the digital and the financial determinants of health. Finally, one of the speakers earlier referred to the big geopolitical challenges, and that for me is illustrated in the next slide. Many of you will have seen this many times over. This is at the inauguration of the American President Trump. And what we see is a significant consolidation of the tech industry and their influence on politics and policies, and as part of a dimension of global markets and global competition. And we can see that these companies increasingly move from a purely economic realm into a political realm. And this is something we have to take into account, where we are also challenging the World Health Organization, because we do have rules, how we work, for example, with the pharmaceutical industry. There are practically no rules how we work with the tech industry and how we can ensure health. You can see on the next slide that the WEF, the World Economic Forum, that regularly surveys their members. You can also see here that the digital risks that misinformation, for example, are seen as one of the key risks faced by the world. And some of the other risks that are mentioned here, like societal polarization, are, of course, also linked to misinformation and the digital risks. And this is an enormous challenge for our societies. And in a way, we have not really looked at it as a commercial determinant. This misinformation is driven by private companies as well. At least they're not doing much to restrain it. So I'll end with drawing your attention to our work with young people. Our young people from all around the world have been working with the Council of Europe to develop a model of digital citizenship for health. How can they participate in addressing the digital and the commercial determinants? I hope you will have an opportunity to look at their statement, and we will continue to work with them. So I hope this has given you some food for thought. I've had to, rush through the whole big arena. But when you discuss commercial determinants, keep the digital determinants and the power of the tech companies in mind. I think you can help take our discussion one step further. Thank you very much.